Assalamu alaikum, the room clinical consultation day. First scenario, Miss Mary, 40 years old, female, referred to you from the GP with a history of headache. Please take history, examine her, and address her concerns.
Yeah, good morning. I'm Dr. Henry, one of the doctors in clinic today. May I please confirm your name and age?
Yes, doctor. My name is Miss Mary. I'm 40 years old.
Okay. Mary, do you prefer I call you Mary, if you don't mind?
Yes.
Okay. So Mary, may I know what brings you here to the clinic today?
Yes, doctor. I have been complaining for headache for the last 3 months, and really, it's worrying me, doctor.
3 months. Wow.
Yes.
That's. I'm so sorry to hear that. That's quite a difficult condition you might have been experiencing so far. Not to worry,
Okay.
we'll do well to address your problem. Is that right?
Okay, doctor.
Okay. Can you tell me more about your headache?
What?
Can you tell me a bit more about this headache?
Yes. So I have this headache actually all over my head for the last 3 months, and yes, it's really bothering me, doctor.
Okay. If you are to rate the headache from 0 to 10, sorry, 1 to 10, 1 being the lowest and 10 being the highest thing you've ever
Yes.
had, which number will you give the headache?
I will give 6.
6. Wow, that's quite much. Sorry to hear that. And do you know anything that you do that make the headache becomes better?
No, I didn't notice. I tried many over-counter medication like paracetamol, but it's usually not working now. Yeah.
Okay. What of anything that's made it worse?
What?
Do you know of any condition that make the headache to be worse?
No, I didn't notice.
Okay. Any do you does the headache does it spread to other parts of the body?
No.
Okay, it doesn't spread. Okay.
No.
Any neck pain?
No, I didn't notice.
Okay. Does the headache worsen with change of position?
No.
Does it occur worse in any particular part of the day, like in the morning or in the evening?
Maybe more in the morning. Yeah.
It's worse in the morning. Okay.
Yes.
Do you feel as if are you feeling sick? Kind of what we call nausea, nauseating. Are you feeling sick?
No. No, doctor.
Any vomiting?
No.
Okay. Any neck stiffness?
No.
Okay. Have you ever had fits or what we call convulsion?
No, 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 doctor.
Okay. Any loss of consciousness?
No.
Any feeling of loss of consciousness or feeling as if you want to faint?
No.
Okay. Do you sometimes feel as if you are confused?
No.
Okay. Do you have any vision problem?
Yes, doctor. I noticed that I have some vision problems. So when I drive, I don't see the side of the road.
Oh, okay. It's so sad to hear that. What of doing the day? Do you have a problem with reading your books and
No.
Okay. Any problem with colors, seeing differentiating two colors?
No.
Okay. Do you notice that some part of your body are becoming bigger?
No, doctor. I didn't notice.
Okay. Okay. Do you have any problem with your hearing?
No.
Do you hear very well? Do you hear something very well? Do you hear things very well?
What again?
Do you hear? Do you have problem with your hearing? As in hearing,
Hearing?
HEA.
No.
Yeah. Okay. For the visual problem, for how long has it been there? The vision problem, the problem with your vision. For how long
Yeah.
now?
I think it starts with the same period with the headache. Yeah. For 3 months.
Okay. Okay. Any problem with your swallowing?
No.
Okay. Do you have constipation or diarrhea?
No.
Okay. Any tummy swelling?
No.
Do you feel your heart racing?
No.
Okay, do you have cough?
No.
Chest pain?
No.
Difficulty in breathing? Do you have difficulty in
No.
breathing? Okay, do you have neck swelling?
No.
Do you have any weather preference?
Again?
Weather preference. Do you prefer cold instead of hot or hot instead of cold weather?
No, no, no,
Okay. Do you have any lumps and bumps on the skin?
no,
Any itching? Any
no,
itching? Itching, no itching. Okay, no, any rashes on your skin?
no,
Any difficulty in
no.
standing from sit? Any difficulty in standing from sitting position?
No, I didn't notice.
Okay. If I'm asked, sorry, do you have any particular condition you have been managing before?
No, doctor. I don't have any thing before the 3 months. I totally normal.
Okay. Any high blood pressure or
No,
diabetes?
no,
Okay. Do you have any family problem, that's a family condition that is any family
mm, no,
condition that is
no.
common in your family?
All
Okay.
my
Nobody.
family is no, no.
Okay.
Yep.
Okay. Have you been admitted recently in the hospital?
No,
Okay. Do you have any drugs you are taking or medication?
no, no.
Any
Just
past
the paracetamol, as I said. Yep.
Okay. Any past surgical history?
No,
Or no past surgical history? Okay. Do you have have you what of is your are you what is your job? What kind of job do you do? Sorry.
yes, doctor. I'm accountant.
Cancers. How is the headache affecting your job? Is it really affecting your job?
Yes, very much, doctor. Since I started this symptom, actually, many days that I not going to the work because of this headache and vision problem.
Okay. So sorry. We'll see how we can help about that by involving the occupational therapy. Is that okay? Okay.
Yeah, thank you, doctor.
Okay.
Yes,
What
be
of
great.
your marital life? Are you married?
Yes, doctor.
Okay. How is the condition affecting your family?
Yes, doctor. Actually, it's affecting a lot. I think that I don't have the desire with my husband, actually.
You don't have a desire with your husband. Oh, yeah. For how long now? Is it in terms of sexual desire?
Yeah, the same period that started.
Okay. For how long? Can you tell me about this condition? Your
Yes, there is loss of the sexual desire. Yes.
loss of sexual desire. Oh, well, it's going okay. Do you have any children? Do you have any children? Have you given birth before?
I couldn't.
Have you given birth before? Do you
Uh-huh.
have any? Do you have
No,
any
no,
child?
doctor. Actually,
No.
no.
Oh,
I do try that for 3 years now. I couldn't have a child actually.
okay, okay. If I'm asked, do you smoke?
No, doctor.
What of alcohol?
No, just socially.
Okay. Do you mind if I examine you, if you don't mind?
Yes, yes. It's okay.
Okay.
Yeah.
Okay. Sorry, I want to look at general inspection on you. Look at if there's any abnormal, you know, position,
No, normal
any
looking.
normal looking. Okay. What of the eyes? The hair is okay. Isn't there any eyes or sorry, as I'm examining, I'm asking some question. How is your menses like? Your menstruation? Do you menstruate very well? As I'm examining you, I'm looking at your hands and I'm asking the question. How is your menstruation like? Is it normal? Is it flowing well? I look
Um,
at your
no, it's irregular, doctor, and it's low
irregular.
amount. Yeah.
Okay, okay, it's okay. I check out any pallor. So any clubbing, any
Flopping? No,
finger clubbing. Okay, what of the anything the pulse
no.
rate? Okay, the BP is normal. What of the BP? The blood pressure.
Uh, blood pressure is normal. Yeah.
Okay, check the JVP. JVP is elevated.
No.
Okay, then check for any pallor,
No.
any jaundice, any oral cyanosis.
No.
Okay, check the any scar in the body, any presence of scar in the anterior chest wall.
Any what?
Scar in the anterior
Scar?
chest wall, any scars? Yes, scar, as in incision
Any
scar.
scar?
Yeah,
No,
on the
negative,
neck.
negative.
Okay, then look at
No.
the eyes. Go straight to
No.
the eyes and then check for your visual field. Check for visual field. Any problem with visual field? Visual acuity?
Acuity is normal.
Okay, what about visual field? Visual field. Any
Visual field is affected.
Yeah.
There is bitemporal hemianopia.
Lovely. Okay, then check. Look at check on fundoscopy too. Use fundoscopy to check the back of the eyes and anything in the back of the eyes.
What you want to see there?
In the back of the eyes, any abnormality, any vessels, any problem, anything in the back of the eyes,
And yeah,
Any
you just offer. No need to do it.
Okay, then go to the abdomen, check the abdomen. Okay, do you have any concern?
Yeah,
do you have any concern? Okay.
Yeah, yes, doctor. I want to know what the problem with me. Why I have this headache and vision problem.
Okay, as I have to just that's a good question. Actually, looking at what you've said so far, the headache you said you had for the past 3 months, the vision problem, and then the difficult to conceive and the menstrual irregularity, and then looking at your eyes, your confrontational test, I noticed there's bitemporal hemianopia. Most likely, you might be having a problem with your what they call the chemical that is produced in the brain called prolactin. And most likely there's a gland in your brain called the pituitary gland. The pituitary produces a lot of chemicals. If the gland is enlarged, because of the over secretion of those chemicals, it might result to you having headache that you're having, and the rest of this most likely that is what I'm thinking that you have. But however, I may need to do some investigation to further confirm to see if that is what you have. Is that okay?
Okay, doctor.
Okay. Any other concern?
No, I'm okay.
Okay. Then I'll have to complete after I've just complete. Okay. Do you mind if I just complete my examination? To just complete my examination, then just do the abdomen, check for anything in the abdomen and the chest. Anything in the abdomen and chest?
No, negative.
Okay. I'm done with them. Then is there anything that I've can I just summarize what is there anything that I've missed out by explaining your complaint to you? Any complaint that you said that or that you that I've not asked you that you want to tell me?
Yes, doctor.
Okay.
I also noted that I have some like milk from my breast.
Okay.
Yeah, this is another thing that I noticed actually.
2 minutes left.
Okay. All right. And you say you are not on any medication prior to this time, right?
No.
Okay. And no family issue of similar complaint, right?
No.
Okay. All right. It's okay. I think furthermore we'll see what we address you involve the occupational therapy will involve the gland doctors and then the other team that to manage your condition. I want to do some scan for you, a picture test, a brain scan, so that to be able to detect what I think is wrong with you. And sometimes we want some chemical tests or you do some blood tests in which we'll see the chemicals if they are high in your body, and then we'll involve both the gynecologist, the endocrinologist, and which is the women doctor. Sorry if you want it to be, and then the specialist nurse, and also the social service to assist with you. Do you drive? Let me ask. Do you drive?
Yes, doctor.
We need to involve the DVLA. So at this point in time, we need to stop driving and then involve the DVLA. I don't know if that's okay.
Okay, doctor.
All right, now. Thank you for having this discussion with me.
Thank you.
Okay.
Okay, Dr. Henry, 40 seconds. You want to examine something or at least to offer it? Examine?
Yes, the breast. I want to examine the breast.
Okay,
I want to
that's
examine
enough.
the breast. Yes, thank you very much, sir.
Yeah.
Thank you.
Okay, so the examiner said no need because embarrassing. Okay. Now the
Okay.
examiner question, Dr. Samia, you can start, please.
Okay. So yeah, present the positive data in this patient in history
I
and
present.
examination.
Okay. Sorry, my phone. I present this. Let me check. Sorry, let me just confirm the age again. I read this 40-year-old woman who presented with 3 months history of headache. There's also history of blurring of vision for the past 2 months, also with menstrual irregularity and menstrual irregularity and prolactinemia by evidence and milk discharge on the breast. On examination findings, there is obvious on visual there's bitemporal hemianopia on eye examination and with visual field defect. So in line with my history and examination, I'm considering the diagnosis of pituitary adenoma, most like causing the hyperprolactinemia. With yeah, that's my diagnosis I'm entertaining.
Okay.
So yeah.
Okay. Other differential you have for this case?
Other differential I have for this case maybe the non other differential maybe, although either drug in maybe intracranial space occupying lesion like other non brain tumor, other non-pituitary brain tumor, such as craniofaryngiomas. Craniofaryngiomas, it could also be meningioma. Thank you.
Okay.
Yeah.
Okay. Okay. Any else differential you have?
Only other differential I have could be also be oh gosh.
Okay, it's okay.
Thank
So
you.
go to the investigation. What investigation you want to do in this patient?
Yeah, thank you. The investigation I would like to do, first of all, I would like to do hormonal profile to check the level of which I expect the prolactin level to be elevated, and also I want to do brain brain CT scan MRI to be specific, in which I have to come down to the pituitary fossa to see if there's any alignment of the pituitary gland, which is the cellular toxica, and to rule out other cause of non-pituitary tumor. I also want to do a full block count differentials. I want to do full block count differential electrolytes and create urea electrolyte. I also want to do breast scan. Like this, I want to do a breast scan for my patient, and also I also want to do. I think these are my baseline investigation. I want to
okay.
start with. Yeah, thank you.
Okay. And the treatment plan for this patient?
Treatment with multidisciplinary approach and involve specific and non-specific management. For the specific management, which will involve the endocrinology and the endocrinologist, the radiologist, also maybe also involve the neurosurgeon, and then the non-specific management will include the we include counseling for visual loss. We include the occupational therapy, include social services, and also yes, and then it will involve the use of certain drugs to reduce the level of prolactin. If the drugs is not these drugs such as cabergoline or
Okay.
bromocriptine, or if bromocriptine fail to resolve fail to bring down the level of the prolactin, we want to consider surgery.
Oh.
Or yeah,
Okay. So
transfenodal surgery.
for the hormones, you want to do other hormone?
Yes, I want to do other hormones, other pituitary hormones, including the other pituitary hormones,
Okay.
such as the level of the ACTH hormone, the other growth hormone, the ADH, the antidiuretic hormone, all the hormones that are secreted by the anterior and posterior pituitary gland. I'd like to say them also.
Okay. Okay. Okay.
I'll ask him one question, Dr. Samia, please.
Okay.
What's your plan for the admission, Dr. Henry? Will you admit this patient?
Sorry to say, I would love to admit my patient. I would love to admit my patient. Sorry, to further for proper investigation, and then address the headache which is impending currently.
Okay, you mentioned the pharmacological or medical option. Any surgical option?
Yes, I mentioned the patient may be for transfenodal resection of the pituitary gland.
What do you think the indication in this patient for surgery?
Yes, basically for the case of hyperprolactinemia, irrespective of the size of the tumor, we need to start with drugs first of all. However, even at this case, when he's having what seems to be by following compression of the pituitary gland on the optic chiasma, we may need to also start with the drugs first before we proceed with the tumor. Before we proceed to the surgery.
Yeah, so you think the size is one of the indication because of the compression over the optic chiasma, right?
Yeah, the size, but however, if there is failed medical therapy, irrespective of how big is the size, we need to start first with medical therapy before proceeding to surgical therapy.
Okay. Okay, thank you, Dr. Henry. Fair enough. Dr. Samia will comment now. Well done, anyway. Let's start, Dr. Samia, your comment, please.
Yes, very well done, Dr. Henry. You catch the case. I just have a little comment. So yeah, when you just discover that it's not acromegaly, you have to exclude the prolactinoma directly. So you have to ask about the discharge from the nipples, okay? So here I give you, because there is time and you say anything you want to add, so I give you actually. But this is the question that is specifically for the prolactinoma. But generally, you get the case. You ask almost the important question. You exclude the red flags for the headache. You ask for the vision. You ask about the female history, which is very important. And yes, you exclude the acromegaly and exclude the thyroid. Okay. I just have a little comment in the history that you used many jargons, like you ask about any constipation. You ask about, you have to use that simple word that like the hard stool or hard motion. Okay. The diarrhea, use loose motion. The vomiting, sometimes they did not like the vomiting. You can say it like throwing up. But generally, you did very well. You asked all the question related. Okay, I don't have any comment on the history except the jargon. Then in the examination, yes, I think you missed a little bit. In the hand, you have to check for any dryness. Like here, the differential actually for this case, the prolactinoma, the first one. The second, you can put acromegaly and tell against that. I couldn't find any feature for acromegaly. The third, you can put the hypothyroidism because she having irregular menses and also less amount as a secondary hypothyroidism. So you can put it as differential. And fourth, you can put the non-functioning pituitary adenoma also. Craniopharyngioma also you can put as something pressing in the head. So yeah, this is the main differential here in this case. And in the examination, I just wanted to hear that the hand, you check for any sign of acromegaly in the hand, dryness, any skin changes. In the eye, you did well. So I ask you what you want to find in the fundoscopy. So yes, if you better to answer that any sign of increase in intracranial pressure like papilledema or optic atrophy, this is the option that you want to see in the exam. They will not mainly they will not tell you to do the fundoscopy, but they ask you what do you expect to find or what you want to exclude from this. Okay, so you say the papilledema and the optic atrophy, not
Thank you.
optic nerve atrophy. Okay. In the
Thank
neck, I wanted you to thyroid, palpate the thyroid and check for the thyroid also. Okay, it's
Thank you.
because like it's one of the differential here. And also, if you did like a very quick neurological examination, the pronator drift and offer for the tone power reflex coordination cessation in the upper limb, because this is a neurological symptom like
Yes.
vision
Yeah.
problem and headache. Okay, so you can do
Yes.
it very quickly. Except that, really good. Then for the investigation, as you said, the MRI and the pituitary hormones. So in some exam, they ask him what pituitary hormone you want to find here exactly. Okay, so you have to mention all the pituitary hormone. So here, the first one, it will be the prolactin. You will ask, tell the growth hormone and insulin growth factor, and then the cortisone, which is the ACTH, and then the TSH, the gonadotropic hormone. You will do the ACTH and TH and T4, okay? The estrogen and progesterone with the gonadotropic hormone also. So all these hormones, you will do it, okay? Even sometimes they might need to do the serum urine osmolarity for ADH, okay? And the pregnancy test also here is very important because she has infertility. So you need to check if it's she's pregnant or not, okay? You have
Thank you so much.
offer this one.
Thank you.
And for the bitemporal hemanopia, there is examination called perimetry. Okay, investigation called perimetry. You will do it.
Perimetry.
Yeah, so here the imaging, the perimetry, and the hormones. This is the main test, plus the pregnancy test. Okay. The management plan, as you said, so in the beginning you forget to ask about the driving, but in the end you ask and you stop. This is very nice. As you said, you involve a group of doctor, but for the patient you will not say the endocrinologist. This is considered as a jargon. Okay, this is
yeah.
you will tell for the examiner, but for the patient, yes, the gland doctor, we involve the nerve doctor, we involve the eye doctor, okay? Occupational
Yes.
health department, like that. And then for medication, as you said, perfectly, we'll start by caprogolin and bromocriptine. If no improvement, then we'll go for the surgery. So the first line is the medical treatment, okay? And for yes, definition, you define that there is overgrowth of the gland found in the base of the skull, release some chemicals, you said, or you can say hormone called prolactin. But this is just my comments, but you did perfectly, mashallah. Actually,
Thank you
this
so
is,
much. Thank you.
yeah,
Thank you so
it's
much.
not
Thank you.
considered.
Thank
All
you.
my comments not considered, actually, yeah.
Thank you. Thank you.
No, thank you, Dr. Samia. It's a good comment from the beginning to the end. How to present, how to ask about the history. I like, or I would like to ask Dr. Henry how to present the headache. You didn't mention or they didn't describe the headache in this scenario while presenting the case. So the examiner will know that you are focusing that this headache is one of the alarming signs or one of the alarming headache. You didn't mention that, right? So if I give you a chance again to present the headache in less than 20 seconds,
Okay.
what can you
Okay.
say? Yeah, please.
Okay. For how long have
No,
you said?
present, not ask. You are presenting now the patient to the examiner.
Okay. Yeah. Okay. There's this a complaint of 2 months history of headache, which was said to be worse in the morning, and with no known aggravating and relieving factor. There's associated blurring of vision with I think okay. Sorry, a headache which was said to be generalized, noted for the past 3 months with no known relieving or aggravating factor, which was said to be worse in the morning and has been progressive over time.
Okay, let's make it simple. Don't be
Okay.
confused. The onset and course duration. Headache started
Yeah.
since 2 months, right? It
Yeah, I said three
was,
months. Yeah.
yeah, what onset? Is it on gradual or all of a sudden? So it was,
Okay.
for example, gradual on. So
Okay.
we have this lady presented with headache started since 2 months. It was with gradual onset and progressive course. Agree?
Yes. Yes.
Okay.
Yes. Yes.
The next will be what increase and what decrease, or what make it better and what worse it, or make it worse. So
Okay.
we can say in this scenario, patient headache was worse with leaning forward or position, changing the position, or coughing or sneezing, and
Okay.
nothing was improving this headache. So this is regarding the factors improve and decrease or increase. The last or the second point or the third point, the timing. Is it related to the time, early morning or at the evening or any time? So it wasn't specific. Then the scale of headache. This patient was having the scale of 6 out of 10 and not or doesn't respond to the painkillers or analgesic. Now we are talking to the examiner. So simply, what you asked, you have to present the onset, course, duration, and what increase, what decrease, and the scale. If there is timing, you can add the timing. So you will
Okay.
give impression to the examiner that I'm asking about every, and I'm presenting them, not only asking, and I'm presenting them. What do you think the importance of presenting this patient is having headache which works with the position, leaning forward, for example? What do you mean, or what's the importance of that? What signify?
Um, headache that is worse on leaning forward.
So it
That's
means
position. That's positional headache. I was trying to rule out BP, benign positional vertigo. Headache that
no,
is
no,
sorry.
no,
No,
no.
oh,
What I mean, yeah,
sorry. I made a mistake. Sorry. Yeah, it has to rule out raise ICP. Headache that has to
exactly.
be
Yes,
raise ICP.
be
Sorry,
simple.
raise
Don't,
ICP.
yeah,
Yeah,
don't think
yeah,
complicated.
yeah. That's
So
true. Raise
yeah,
ICP.
all these signs going with
Okay. Yeah,
headache would increase intercare
yeah,
pressure. By the
yeah.
way, this is an indication to have urgent CT brain as well as to admit the patient. Okay, so you have patient with signs of increased intercare pressure. I should admit this patient. That's why I'm signifying every single point in the history. We should say this patient is having this such kind of headache, which is worse or improve or related to the position, sneezing or coughing. Even the neck stiffness you ask about, which is very good in this scenario. Why do you think the neck stiffness here is important?
Yes, it's also for subarachnoid hemorrhage and meningitis.
Perfect. So
Okay.
the signs of meningism. If it is
Mm.
positive, again, this is another indication, and I should
Mm.
rule out meningitis immediately, right?
Yes. Yeah.
This is regarding the complaint itself. The relevant system you analyze with, which is the vision, hearing issue, weakness, pins and needles, or the speech, a change in the speech, or difficult to speech. Okay, or the balance as well. You can ask about any change in the balance or unsteady, feeling unsteady. That's regarding to the complaint and the relevant system. The next system you missed totally in this scenario, and I can tell you, if you didn't ask these questions, you might forget the case, which is important here, Dr. Hina. You didn't ask one of the questions as a package. Constitutional symptoms. Did you ask about the weight change? Do you ask about the appetite, the night sweats,
No.
night fever? What do you think the importance of this?
Malignancies.
Yeah, so you can put in the differential what?
Mm. Yeah,
Malignancy in brain means
malignancy,
what?
brain, yeah, brain tumor.
Yeah, brain tumor, space occupying
Mm,
lesion, which is
yeah,
also one of the differential in this scenario,
yeah,
right?
that's true.
You
Mm.
have to ask every single question related to the history, and don't forget always to ask the constitutional symptoms. Okay, next question, as per my approach, the past medical history. You ask all question for past medical history, any surgery, any procedure, any medical condition should be aware of, like hypertension or high blood pressure or high blood sugar. Okay, let's assume this patient had a surgery recently or had a procedure. What you can add to your differential?
I had a procedure
Yeah.
recently. If you had a procedure maybe recently, like there's maybe bleeding towards the procedure, I think of Sheehan syndrome, or pituitary apoplexy. If there's a
Okay.
bleeding to, yeah,
Okay. So you think about Shihan as postpartum, right?
yes,
And
yes.
patient will present with Addison, for example, feature, but not in this scenario. But it's okay to specify the procedure and to ask about the procedure. But I mean another procedure which can lead to severe headache with increased signs or signs of increased intracranial pressure.
Maybe spinal procedure, lumbar
Um,
puncture,
okay,
yeah, spinal
okay, okay.
procedures.
Spinal procedure, what can lead to? Brain edema,
Yeah,
you mean?
maybe there's a maybe a the CSF
The
lumbar
leakage of
puncture
CSF.
yeah, leakage of CSF might result
Okay,
to headache too,
so it would
and
lead
cause
to yeah, brain edema and okay, headache. Okay, something or procedure in the face, for example.
in the face
Yeah,
or
what?
procedure in the face.
Yeah.
Um, um, if
Okay,
there's a
let's assume the skull base or base of the skull.
okay, base of the scalp,
Skull, yeah.
skull, okay, base of the skull, okay,
Yeah.
craniotomy.
Okay, this is major surgery. No, I'm talking about procedure. Something in the nose, sinusitis, okay,
Okay.
or
Yeah,
dental surgery. So,
yeah.
what you can add to your differential? And by the
CSF
way,
leak.
yes, not only leak,
Mm,
infection. Infection. So you will think about what? Meningitis again,
yeah,
right? Or
yeah.
cavernous sinus thrombosis,
Thrombosis. Okay,
right?
yeah,
This is also one of the
yes.
differential you can add here if you have this procedure in the past or prior to the presentation or the presenting symptom. Okay, so that's why
Okay,
every single point in the history it might signify something. In this issue or in this scenario, if you ask about the procedure and she told you, yes, I had this or that, I mean the surgery, dental, or something in the face, cavernous sinus thrombosis should be added and to be rolled out. Okay.
okay.
Okay. This is regarding to the past medical history, including the surgery, the procedure, and allergy. Of course, you have to think about allergy. The medication history is very important. What do you think the important medication you should ask about in this scenario? Two medication is very important to roll out a condition.
Uh, medication. Okay, and
Perfect.
yeah.
What you said? Medication what?
Also, spironolactone. All the that will cause sorry, prolactin.
Yeah, okay. You mean for the high prolactin antipsychotic?
Antipsychotic. Okay,
Yeah, any medication having a dopamine antagonist
yeah. Okay,
effect, it would lead to the same high prolactin, but it will not be the same numbers of prolactinoma. It will be high, but it's not high, sky high, like prolactinoma, for example. One more medication, if this patient is taking paracetamol or opioid for almost 3 months in daily basis, what do you think you can add to your differential, which is not in this case, but you have to ask about it as over-counter medication? What we
drug induced headache.
medication overuse headache,
Medication overuse headache. Yeah.
but not in this scenario because this headache
Mm.
will not be with the signs of increased intracranial pressure. So what I want to say, every single question either to give you a clue or to rule out something. Okay, so medication or over-counter medication, sometimes it comes in the basis as over medication overuse headache. So you will have patient taking, for example, opioid for more than 3 months, and he's dependent on this medication, taking them more than 2 weeks per month for 3 consecutive months. In this scenario or in this condition, you can think about medication overuse headache or paracetamol, even paracetamol. Okay. If you have
Okay.
this condition, what you should do if the patient is already taking paracetamol for more than 3 months and 2 weeks per month, and you diagnose him as medication overuse headache, how to treat it? Paracetamol.
Mm. How to treat it? We
Yeah.
will stop. We stop the paracetamol.
How to
Yeah,
stop the
yeah.
paracetamol?
You have to stop abruptly.
Perfect. What
Mm.
if you suspect the opioid?
In opioids, we have
In
to
opioids.
stop gradually.
Exactly. Okay. So you know how
Mm.
to address this. If the patient asks you, doctor, is it something to be stopped abruptly? Yes, paracetamol as medication overuse should be stopped abruptly, while in the opioid, you have to stop it gradually. Okay. The systemic review, you cover the all question, but you forget the most important question for our case. Let's assume this patient is having acromegaly. So the specific question in the systemic review will be, Dr. Henry?
If the patient is having, if I'm suspecting acromegaly, I'll ask if there's any,
Yeah,
if any of his if there's increase in size of his hands,
perfect.
his digits, yes.
Perfect. So
Mm.
either to ask this question, increase the hand size or the ring size. Do you notice the
Mm.
ring size being more tight, or the shoes being more tight? And the facial features as well. You can ask, do you think someone or anyone told you that your facial features changed, or did you notice in front of the mirror that your facial features increased or changed? Okay.
Okay.
So this is for the acromegaly. For bullactoma, you have to ask about, sorry for this question being a sensitive question, any discharge coming from your nipple. In the male, any you will ask about any discharge or even any change of your breast size, and be sorry for this question as well, right?
Mm.
Okay, what you call the discharge from the nipple, which you couldn't.
Galactoria.
Yeah,
Galactoria.
exactly, galactoria.
Sorry,
And
I,
yes,
sorry,
I
I
wrote it
was
for
trying
you.
to.
No, no, it's
Yeah,
okay.
I saw it in your chat, but
No problem.
yeah, it just escaped my mind. Yeah,
Yeah, I'm trying to write everything because sometimes I miss the comment or while
yeah,
commenting. So
yeah,
galactorrhea is the milk discharge, while increase
yeah.
the size is called gynecomastia.
Commercial, yeah.
Okay, so these are the most common pituitary adenoma in cases, the acromegaly, as well as prolactinoma, and the third is Cushing, right?
Yeah.
Cushing. And you will have what condition you will have in Cushing. So the presentation, how the patient will present with.
In Cushing,
Yeah.
you can present with round face, fatigue, weight gain.
Perfect.
Mm.
Yes. What else?
They can
Cush-
also present with
Cushing disease.
Cushing faces, yeah,
Yeah.
Cushing
So
disease, yeah.
yeah, and the skin will be
Skin will be there'll be some stretch marks on the skin. The patient will still,
exactly.
yeah,
Yes. Easy
mm,
bruises, stretch
bruises, yeah.
marks, or striae in the abdomen.
Sorry,
The obesity, truncal obesity, hypertension, and you
hypertension.
mentioned already the yeah facial. You mentioned the facial change or like hair hirsutism. You mentioned or acne. So these
Yeah,
are the possible presentation of Cushing disease. You will have these things. The third or the fourth, sorry, this is the fourth pituitary adenoma in cases, and it comes as another or separate scenario you mentioned earlier, which is non-functioning adenoma. and the patient will be presented with Addison, hypothyroidism, right?
Yeah.
Or hypogonadism and amenorrhea,
Yeah.
particularly in cases Sheehan syndrome. It comes in this way: Sheehan syndrome as postpartum complication, bleeding, and hypotension. The patient later on being amenorrheic, or she is having Addison manifestation or hypothyroidism. Okay,
Okay. Okay.
so these are the pituitary adenoma you have to know in phases, and everyone comes in phases. If you have pituitary adenoma in scenario, what you should rule out? Pituitary adenoma per se. Okay, you already have now pituitary adenoma. What else you should roll out as a differential?
Phenopharyngoma.
No,
Okay.
means you as a
Peculiar adenoma.
differential. The cringe
Peculiar
again?
adenoma. Is it with pressure symptoms?
Yes, I know, but I'm talking about syndrome.
Okay.
Something
Syndrome. Okay. 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 Men. Men. What that men
perfect.
one?
What's what
Men one.
type? What type of men
Men
you
one.
have? Yes,
Men one.
exactly. So what's the
Yeah.
question you should ask?
Yeah. I want to ask you if there's any heartburn, like carcinoma, maybe
Okay,
epigastric pain.
so this is for the
Also
pancreas. Okay,
pancreas
okay,
too, and then
okay. So
yeah.
one of the questions for the tummy pain. What else you should roll out?
Yeah, if there's if you're having steatorrhea, as in
Okay,
yeah, steatorrhea, then the
vipoma,
place for
you
the
mean?
pancreas, yeah,
Vipoma. Diarrhea, not
okay,
steatorrhea, the vipoma. So the patient will have watery diarrhea, not steatorrhea.
which
Vipoma. Okay, what else?
oh,
One more. Insulinoma or glucagonoma. So the patient either will be hyperglycemic or hypoglycemic, right?
yeah,
Okay, the
yeah,
third component of men, and you have to ask, what is it?
parathyroid.
So how you ask it?
If there's I'll ask if there's evidence of like constipation, flank pain, and
Perfect.
excessive urination and
Perfect, yes. These
confusion.
are,
Yeah.
yeah, yeah, or confusion or change of the
Mm,
mood, low mood,
mm,
depression, and the bone pain, and you already mentioned tummy pain, or renal colic, or even passing
mm,
stone, and increase of the water work. By the way, if you ask the systemic review, for example, any urine change, suppose if there is men association, he will find polyuria, for example. He will tell you, yes, I have increased in the amount. If you want to specify a question, you can ask him, how is the amount of your water work? Just to be more specific for the question. Because you might ask him any change in your water work and he will tell you, no, doctor, I didn't notice. To be more specific, ask him about the amount, or you will find the tummy pain manifestation of hypercalcemia in the other organs, okay? Like tummy pain or confusion, okay? Or bone pain.
okay.
Okay, the last social, yeah, the social now, you ask about the family history, but you didn't specify what type of family history you want to ask. If you suspect men, for example, how to ask this question? You will ask him any family history of note or of same condition. What do you think the specific question, or what you can specify the question more for the men?
Um, any family history of
Yes.
okay for any family history of similar condition.
Okay, he will tell
Exactly.
you, she will tell you, no, no, nothing. I cannot remember. But you want to specify for men.
For men,
Yeah.
okay. Is there any family history of excessive urination?
No, don't be more specific. So what I mean, any gland history or any family history of gland disease or gland
Okay,
cancer,
gland is okay,
right?
okay, okay. Yeah,
Yeah, but it's not hypercalcemia only. So any gland,
yeah.
because some surrogate will tell you, no, doctor, I cannot remember. So if to be more specific, you to ask about any family history of cancer or gland issue or gland disease. Yeah. So any cancer means space occupying lesion or cancer, brain cancer, even pituitary adenoma. He might tell you, yes, my father was having, for example, a gland or cancer in his gland in the brain. Okay, the female history here, you have to ask all question, 3 Ps, pregnancy, and the period, which should be here stopped, and the birth control pills. You can add a question for, are you pregnant by any chance? Because this patient is having amenorrhea. The travel history you already mentioned, the recreational drugs, HIV questions, the intimacy, she was volunteered to tell you, yes, I don't have, or sorry, I have some change or reduce of my desire, sexual desire. Always be sorry for this question, okay? Do you use the question, do you smoke, do you drink alcohol? Do you drive is very important, and you have to address it immediately whenever she mention it to you. For example, in the beginning, she told you, doctor, I noticed that I'm bumping into the object, or when I drive, I cannot see the sides. Please, in the same time, address it. Why? Because you might forget exactly. So at least you already finished this point. When you comes to it, don't repeat it. Okay? If you have time, you can ask. So, or you can say, yeah, you told me about your driving. Please again, stop driving until confirming the diagnosis and being free of vision problem. So, the beginning or at the same time, in order not to miss it, because if you ask it later on, okay, if not, you will miss it totally. As in this scenario, you didn't ask unless after examining the patient. That's why you miss it, because you didn't do it initially. Okay, so my advice always, not only you, anyone, the surrogate was volunteered to give you a knowledge or information that he's doing this risk habit, immediately address it. Doctor, I am drinking much alcohol. Do you think it's related to the alcohol? You can even address it even you are not in the personal history. Why? Because you might forget it later on. Or during the personal history, if you ask it, you can immediately give him advice. Don't wait till the end. In this scenario, the smoking was negative, the alcohol was negative. The job you asked was good question. Also, the effect in the partnership, what's also good question to ask, because again, it was affected or it was low or less libido or less desire, okay? The examination, you cover all. I will not talk about it because you did everything in the examination. The hand signs, as Dr. Samia said, you have to roll out acromegaly, the blood pressure, and if you have acromegaly, you have to do the examination of acromegaly for the hand, sweating, increase the size, skin tags, and so on. Related to the vision, you have to do the acuity first. So if a patient is seeing you, you can continue to the field. If she told you, doctor, I cannot see, now you cannot do the field. I will add to the differential of fundoscopy what you can see in the fundoscopy. Dr. Samia mentioned the optic nerve atrophy. She mentioned the papilledema. I will add also hypertensive, if this patient hypertensive, for example, or any retinopathy. Okay, some acromegaly patient will be either diabetic or hypertensive, right? Acromegaly is always associated with hypertension and diabetes. So you might have the changes in the retina due to the diabetes or hypertension. So it would be retinopathy related to the diabetes or hypertensive. Okay, the point also discussed for the topic, I mean the prolactinoma, how to manage, the medical option, the surgical option, always mention the multidisciplinary team approach whenever you have multi-system affection. Dr. Henry, please, I ask you please now to post the case for Dr. Samia to be ready, then we will address any doubt.
Dr. Hani, just I want to add for you concern. Do you think can I have kids?
Good question.
If you can have kids, as it is now, I'm not in the best position to tell you that, because is a I will, after I've confirmed my diagnosis and then the both the gland doctor and the female the doctor that specializes in women condition, when they come together, they have to be in the best position to counsel you towards that. Is that okay?
Okay.
Okay.
So
Okay,
this is
doctor.
a diplomatic answer, which is good
Yes.
also. It's safe and diplomatic answer. But
Yes.
let's talk about scientific answer. Will this patient have pregnancy? She has prolactinoma, means high
Yes.
prolactin, and always prolactin will decrease what by by negative feedback.
Mm,
All the gonadotrophin will be low,
mm,
right? How she will get
yes.
pregnant? So if you control the high prolactin and the axis of the gonadotrophin released hormone will be intact, this patient might have pregnancy, right, Dr. Samia?
Yes. Yes. The answer is yes. After treatment
Yeah.
with the appropriate medicine, you can have a kids. Yes.
Yes. Okay. Thank you, Dr. Samia. Good concern, by the way. And the answer again, if you don't know, just answer in diplomatic way. I will ask my senior. I will update you in another meeting. But if you don't know, we give and you give wrong answer, they will minus you in the clinical judgment. So either to be safe, diplomatic, I will refer to the specialist, or I will update you, or I will ask my senior, whatsoever. If you know it, you can answer it. Dr. Henry, please put
Okay.
same scenario for Dr. Samia.
Okay.
So
I've posted it.
you post
50-year-old
it.
woman presenting with fatigue.
Okay, good. Dr. Samia, I will give you 2 minutes. I will read the comments. Then we will start with you. Oh, it's okay. Headache divided into, yes, acute, Dr. Tahani. Acute and chronic, of course. The acute include subarachnoid hemorrhage, meningitis, pituitary apoplexy, sinus thrombosis, all others chronic headache. Okay, you can use this division while approaching the
But
case of headache.
meningitis can be chronic now. We also have
Some,
chronic meningitis.
yeah, some. It's not as a rule. However, it might happen, and you
Even
should ask about.
subacute meningitis.
Yes, I agree. So you have to rule out anyway the neck stiffness or signs of increase in tachycardia pressure. But in this scenario, it seems to be something growing with
Because
increased tachycardia pressure.
because I was thinking that headache may be primary and secondary instead. So acute and chronic. Why not primary and secondary headache? Instead of acute and chronic. This one tends to be misleading. It's better you say primary and secondary headache than saying acute and chronic. It's not
Yeah,
because in primary headache. Mm,
yes, you're right. But she's dividing according to the onset because you will not know the onset from the patient. You can know the onset from the paper itself,
okay,
the scenario.
okay,
So
okay, I
you can
understand.
put good differential from
Mm,
the beginning before going inside the station. I mean, if you have, for example, in the complaint, patient present with severe headache started 6 hours or a couple of hours ago. This would be differential to another patient in the scenario written. Patient have headache for 3 months. So the first scenario you can put, as Dr. Tahani mentioned. So you can put subarachnoid hemorrhage. You can put the meningitis, and you can put, for example, ICH, intracranial hemorrhage. Simply put the most common acute headache causes. In the other arm, if you have patient with headache for the last 3 months, you cannot say this is subarachnoid hemorrhage, right? Subarachnoid hemorrhage always comes as acute. So the other causes will go to the other division, which is, as in this scenario, you can think about space occupying lesion, something taking long to be growing, or even the macroadenoma, or for example, as in the hypertensive encephalopathy, for example, patient having hypertension on and off,
mm,
confusion, and so on. Other
mm,
causes of headaches without increased intracranial pressure, you have to think about tension headache, cluster headache, and migraine. Don't
okay,
forget such headache, tension headache, cluster headache, and migraine. It comes as chronic headache with no signs of increase in intracranial pressure.
mm,
Okay.
Mhm.
There is certain causes, by the way. I put them in a group or in the message in the group. So we will I will resend it. You will know what all basis headache comes in the exam. But these
Okay.
are the most common one. Okay.
Okay. Thank you, Dr. Bazin.
Yeah, most welcome, Dr. Hina. Thank you too. Dr. Samia, you ready?
Yes, yes, let's start.
Okay, so 50 years old woman. Let's assume she's Julia. Julia Adam presenting
Okay.
with fatigue. Yeah, here you go.
Okay, hello.
Hi.
My name is Dr. Ahmed. I will be the treating doctor for today. May I confirm you are Miss Julie Adam and you are 50 years old?
Yes, doctor.
Miss Julia, we are here to discuss some issue regarding to your health. I'm examining you. Is that okay with you?
Okay, doctor.
Okay, can you tell me what brings you here today in the hospital?
Doctor, I've been very tired for the past 3 months now. I've been feeling very,
Mhm.
very tired, doctor. That's why I
I'm so
came,
sorry
doctor.
for I'm so sorry for that. We'll try to help you, Miss Julia. So before the 3 months, you are totally normal.
Yeah, I'm not totally normal anyway, but I've not
Mm,
been fine too. But what is
mm,
giving me trouble now is this my tiredness, and I'm
mhm.
feeling very weak.
Okay,
Yes.
okay. So this tiredness since it started, it's worsening or improving or the same?
It's worsening. Yeah, and yeah, it's worsening,
Mm-hmm.
doctor.
Do you notice anything make it better, like taking rest?
If I'm resting, I don't feel it. But whenever I'm working, sometimes even when I'm resting, now I just feel tired. Feel
Mm-hmm.
as if I'm lazy. You
Oh,
know.
okay. Anything make it
Uh,
worse?
no, not at all. Nothing.
Oh, okay. Do you notice this tiredness? It's all over the day or just in specific time of the day?
All over the day. All over the day. I'm
All
just
over.
tired. Mm.
Oh, okay. Okay. Do you have any increase or decrease body temperature?
No, doctor.
Anyone told you are paler than before?
No, doctor.
Any dizziness from standing sitting position?
No, doctor. I just feel as if no, doctor. But
Okay.
just
Do you have
sometimes I feel as if I want to faint. Sometimes. Mm.
what?
Sometimes I feel as if I want to faint. I want to
Ah,
collapse. Sometimes,
okay.
yeah.
Okay. Okay.
Sometimes, yeah.
Okay.
Mm.
Okay. Okay. Do you have any lumps or bumps in anywhere part of your
No,
body?
doctor. No, no, doctor.
Any weight changes?
Weight changes. No, doctor.
Do you have any loss of appetite?
Yes, I have lots of appetite. Yes, doctor. Mm.
For how long?
The same for about 2 months
Mhm.
now, doctor.
Okay. Okay. What about your mood, Miss Julia?
I'm just sad, doctor. I'm just sad.
Yes. Why you said, Miss Julia?
Yeah, because I've been sad. Initially, I first start having some pains in my back. Then later, this weakness comes in. I'm just tired, doctor. I'm just tired.
Mm-hmm.
Mm.
Okay, I'm so sorry for that. I'm so sorry to ask you this question. Do you think that your life is not precious or anything like that?
No, 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 no.
Okay. What about sleep, Miss Julia?
Yeah, I sleep well. I sleep well.
Mm-hmm.
Mm.
Okay. Uh, okay. Do you have any itching,
No, no, no itching, doctor.
any sweating or night sweating,
No, 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 doctor.
any weather preference,
No, doctor.
any neck swelling?
Leg swelling. No, doctor.
Okay. Do you notice any skin changes,
Skin changes. No, doctor.
any skin rash,
No,
any joint pain,
no, doctor.
any back pain?
Yes, that like what I said, that was what started first. But
Oh,
eventually, I've been taking some paracetamol for it,
uh-huh.
for the pain. So now the pain is not as bad, but now the weakness is much. Now, yeah,
Okay, you noted this back pain like in specific spots in your back or
yeah,
all over
just
your.
at just close to my mid of my back, the middle part of
Mhm.
my back. Yeah,
Okay. Do you have any trauma to your back?
no, no, not at all. No, no, no,
Okay. Okay. Do you have Miss Julia any travel history recently?
no, no, doctor.
Okay. Do you have Any yellowish discoloration of your eyes?
No, doctor.
Do you have any headache?
Headache? No, no, doctor.
Any vision problem?
Vision problem? No, doctor.
Any weakness in any part of your body?
Yeah, I've weak. My body is weak. I'm just tired. You know.
Like
So that when
tired. I
yeah,
mean that
just
you cannot
weakness.
move.
No, I can walk. I can walk. I can
Okay.
walk, doctor.
Okay.
Mm.
Do you have any difficulty of breathing?
Yes, I do have some, breathlessness
Difficult.
when especially
Uh-huh.
when I walk for a very long time. Yeah, I have it. Mm.
Okay.
Mm.
Okay. So do you think this difficulty of breathing increase when you are lying flat in the bed?
No, no. It's only when I'm walking.
Okay.
Sometimes
Do
I feel as
you
if and then I feel as if I want to faint. This one started
okay.
occurring for the past 2 weeks now.
2 weeks now.
Yeah, yeah.
Okay. 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 So do you wake at night like catching for air?
No, doctor. No, no, no,
Any leg swelling?
no, 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 doctor.
Okay. Do you have any racing or pacing of your heart?
Raising a pacing of my heart. I just feel as my heart is beating very fast, but it's kind of the pacing is kind of in regular pattern. Mm,
Okay. Okay.
mm.
Just with walking or uh,
Yeah, even sometimes when I'm relaxing, I just feel as, but it's worse when I'm walking
mhm.
for maybe walking, climbing the staircase, or maybe going to the market. I just have to just sit
Okay.
down somewhere and rest. Yeah.
Okay. Okay.
Mm.
Do you have any cough?
No cough, no doctor.
Any cough of blood?
No, no, not at all.
Any change in your bowel habit?
Yes, I urinate a lot. Yeah, I urinate a lot, doctor.
You mean lose motion?
You mean my water works, or I don't know what was your question? So
No, I asked about the bowel habit. Any change in the
okay,
bowel
bowel
habit?
habit. Oh, yes, doctor. Yeah.
Uh-huh.
I usually be unlike now. Before I used to go to the toilet once a day, but now once in 3 days. I don't know. Mm.
Okay. So you have lose motion.
No, I'm not having loose motion. I used to go to toilet once in 3 days. I go to toilet
Once in
once
three
in
days.
3 days.
Okay.
Yes,
Okay.
yes.
Okay. So there is hard stool.
Mm.
Okay.
Not really, yeah, kind of sometimes.
This is
Hard.
the usual. What they usually going to for a stool?
Before it's once a day. Once a
Once a
day.
day. Okay.
Yeah.
Okay. Okay.
Mm.
Okay. Any bleeding from your back passage?
No, no, doctor.
Okay. Do you have okay. Any black stool?
No, doctor.
Okay. What about your water work?
Yeah, I urinate a lot, doctor. But recently the
Mm-hmm.
urine is kind of is going down. But
Mm-hmm.
for the past 3 months, initially it was much, but now it's kind of it's going down a little bit, and I'm not comfortable with it. Mm.
It's a little or more?
Yeah, previously, when I started having this weakness, it was much, but now
Uh-huh.
it has started coming down now gradually.
So how many
Mm.
time you go for the water work?
No, now it's kind of coming down to normal. Unlike, when it first started, it was much. I can go up to 10 times in a day, but now it's kind of
Oh,
once 2 times in a day now, which is not that
oh,
bad. Mm.
okay. So how you was compensate that time?
I just feel that probably because I was weak, I was going to toilet, urinating much, but now I just feel that it's not
Mm-hmm.
really as it was, within the past 3 months when I started feeling weak.
Okay. Any frothy urine?
Mm. I don't know. I don't usually check when I urinate. I
Okay.
just
Do
flush
you
and go.
have
Mm.
do you have any past medical or surgical histories that I should be aware of?
No, not at all. No, doctor.
Okay. Any medication that you use?
Medication? Yeah, for the pain, I used to take
Uh,
paracetamol and
just
sometimes ibuprofen. Yeah, for the pain.
uh
I'm still taking them till now.
okay.
Mm.
Okay. Except this, no other medication.
No, no, doctor.
Okay. Do you have any allergy to any medication?
No, doctor.
Any family history of similar condition?
I'm just concerned. My elder sister, not that I didn't have, but I'm scared because my elder sister has breast cancer. So
Has breast cancer?
yeah, he has breast cancer. Yeah, but me, I'm very worried because she has breast cancer. But outside that, my family has been good, you know.
Oh, okay, okay. What about your period, Miss Julia?
My period has been okay, but now because I feel as if I'm getting towards the menopause because I started seeing period at a very early age. Yeah.
Okay. Do you take any medication for the bone protection?
No. Do you have any bone problem? I don't know if I have any. No, I don't take any medication. I don't have any bone problem, doctor.
Oh, okay. It's okay. So, Miss Julia, what's your job?
My job, I work in the supermarket. I'm one of the managers in the Tesco, the shop here in the United Kingdom.
How does this impact you in your job and daily activity?
Yeah, it has because I work a lot to instruct my other worker, but now instead of me working, I have to sit down and walk through the telecom to control, to talk to them via the telecom instead of going to instruct them.
Okay.
So it's really affecting my job. Yeah.
Yes, we will try to help you regarding this, Miss Julia. We involve
Okay, doctor.
Yes. Okay. Can I examine you, Miss Julia?
Yes, you can. Yes, you can.
Okay, we'll start by examining the vitals for the patient. Any sign of postural drop or tachycardia or?
Yeah, there's tachycardia. Pulse rate is 120 beat per minute, regular.
Any postural drop?
No.
No. Okay. Then I will check the hand if there's any sign of pale in the hand, any dryness or sweating, any sign of dehydration.
Yeah, there's sign of pallor. There's pallor. And then a little bit of dehydration. Yeah, there's
the skin turgor is increased.
Yeah, not increased, but the capillary refill is kind of poor.
Capillary refill. Okay.
Yeah.
Okay. Okay, then I will go directly to the face. I will check if there's any pale or jaundice in the eye.
Okay, there's pallor. There's pallor.
Okay. Then I will check the mouth if there's any sign of dehydration.
Yes, mouth is dry, kind of.
Okay. Okay. Then I will check the neck if there's any lymph node enlargement.
No.
I will go directly to the back. I will check for the back. I will palpate if there's any points of tenderness in the back.
Yeah, there's some tenderness in the lower thoracic vertebra.
In the lower part?
Yeah, lower thoracic, around T11, T12, that area, lower thoracic region.
Lower thoracic region. Okay. Any deformity in the back?
No, not really, just pain.
Okay.
Just tenderness.
Okay. Okay. Then I will check for the chest because she has some difficulty in breathing and palpitation. So I will check for the heart if there any sign of heart failure or any murmur.
Okay. It's just hemic murmur.
There is hemic murmur.
Yes.
Okay. 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 Any crepitation? Basal crepitation?
No.
No. Okay. 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 Then okay, we finish my examination by examining the abdomen also because she having some constipation. I will check if there's any masses in the abdomen or pain.
Okay, abdomen is normal.
Okay. Any lower limb edema?
No.
Okay. Okay. Then Miss Julia, do you smoke?
Yes, I smoke. Yes, doctor.
How many cigarettes and for how long?
And for the past, I've been smoking since when I was 25 years. I used to smoke 5 to 10 stick of cigarettes, doctor.
Okay, Miss Julia, actually smoking is very problem in your health. So I really advise you to stop smoking. And if you need help, I can refer you to smoking cessation clinic. Do you drink alcohol?
Alcohol? No, doctor.
No. Okay. Okay. Do you think these symptoms might affect your driving, Miss Julia?
I don't. Well, I don't think so because I drive, but I don't know. I don't think so.
Oh.
I don't.
Oh.
I see very well, doctor.
Oh, okay. It's okay. Okay, Miss Julia, what's your concern?
Doctor, do I have breast cancer?
I really appreciate your concern, Miss Julia. Breast cancer is the least likely in your condition. I have many possibilities. One of them that it's my related to the low blood count, which called anemia. Okay. Other possibility that I have, it could be related to pharyngeo, other problem called fibromyalgia. Okay. And yes, and others, we need to exclude others also. So I need to admit you actually in the hospital. I need to run some investigation, including blood and imaging. Okay. And involve a group of doctor, including the blood doctor. And also we can involve the gut doctor, also the mood doctor we can involve here, and the occupational health department and other specialty if needed. Then after that we can sit with you and tell you about the next plan of management. Is that okay with you, Miss Julia?
Doctor, but you didn't see my breast and see if truly I have breast cancer or not. You didn't see my breast. You didn't ask me if I have any breast discharge or breast pain. You just conclude that I don't have any breast cancer. Okay, if you say so, no problem. Okay, it's okay. It's okay. Thank you.
Oh, do you have any breast problem? You feel any pain in your breast or any enlargement or masses or thing?
That's what you'd have asked me, this. But I don't know, you can check. I don't feel anything, but you can just check and see. Don't feel
Okay.
anything.
Oh, okay,
Okay.
thank you.
Okay, I added 1 minute and 30 seconds more just to address the
Yeah.
concern. Now the time for
Okay.
exam lab. Well done, Dr. Samia. Let's start the exam question. Dr. Henry, please.
Can you please present your positive findings of your patient?
Okay, I have a 50 years old female. She came complaining of tiredness for the last 3 months. It's all over her body, and she has also loss of appetite and has a symptom of anemia, palpitation, and difficulty of breathing, and some dizziness when standing from sitting position. Then also she has a low mode actually, and she has back pain in specific areas, uh, specifically in the mid of the back. And also she has constipation and polyuria. And she's taking just over-the-counter medication. She has a positive family history of breast cancer. And yes, she is a smoker. In examination, I couldn't appreciate any positive sign except the pallor and the sign of dehydration. And also she has anemia and anemic heart failure. Because she has a hemic murmur actually in this patient. So my summary of my finding, there's many possibilities for the fatigue in this patient. Mainly I put anemia in the top of this symptom. Also, I can put the fibromyalgia because she has some back pain specific area. She has also sign of hypercalcemia, I think constipation, low mode, polyuria, but I don't know where to put this actually.
All right.
So
Thank you very much.
yes. Okay.
Okay. All right. How do you invest? What are the investigation you want to do to manage up to complete that? Yeah.
Investigation. I will start by the basic investigation, including the full blood count. I'll check for the anemia workup or the anemia workup in this patient. Then I will do the liver function test, renal function test, urea and electrolytes in this patient. Then I might need to do some imaging to the back, okay, to exclude if there's any problem in the back or abnormal lesion. I want to do the calcium profile also for this patient. And yep, this is the main thing that I
Okay. So what management, how do you treat this patient?
Okay, this patient need admission,
Okay.
need to fluid replacement, and also we need to treat the anemia for this patient, either blood transfusion or any medication according to the blood doctor. Okay. Then, yes, I will give her replacement actually for, because she's 50 years old, so bone replacement, she might need the hormone replacement and the calcium, vitamin D, even the bisphosphonate might be needed. Then, yes.
All
Then
right. Thank you very much.
yes, yes. Okay, we'll
Okay.
manage
Thank you very
accordingly.
much.
Thank
Okay.
you.
Actually, you tried. You did very well in your history. You were patient with the patient.
Yeah,
You
Dr.
asked.
Henry, it's still 1 minute and a half. You can add
Okay.
more question. How to manage
Okay.
what
Yeah.
you mentioned?
Yeah.
Yes.
Yeah. Are you done with management? Are you done?
Okay. So this patient, yes, after admission and supportive management for this patient, yes, we can, because she has a positive breast cancer. Also, we can do some scans for the breast actually to exclude if there's any breast cancer that might spread to the back or anything. Yep.
Okay.
Yes, I think that's all. Yeah.
Okay. If this particular patient, if you are thinking of hypercalcemia, what's the likely cause of the hypercalcemia? What's what is likely to be keeping with the hypercalcemia the patient is having?
The feature that she has constipation, she has polyuria, she has low mood
Yeah.
in this patient. Yes.
Okay. It's okay. All right, Dr. Bazim, I'm done.
Yeah, okay. The last question. What do you think this patient, why she has low urine output nowadays? As he mentioned to you, or she mentioned to you, I was passing a lot, but now I have low or less urine.
Okay. She
The
might
last
develop
question.
like acute kidney injury because of the dehydration, hypovolemia. I'm not sure actually.
Yeah, perfect. Okay, good answer. Okay, well done. I think 5 minutes now. Dr. Henry, you can comment.
All
Thank
right.
you. Dr.
Yeah. Thank you for the history. Thank you for the your approach was okay. You are systematic. You went almost through the past medical history. You addressed on my concern and everything. But I just feel that in a way you got the individual features, but you didn't hit the nail on the head. You didn't get the diagnosis. In as much as you get the individual component of the diagnosis, what is there for to just marry all the components, and you have to get one particular thing. Somebody posted in the group chat, which is multiple myeloma. That is what this
Multiple
patient has.
myeloma.
Yeah, because if you
Okay.
look at, if you take everything that you mentioned, it will all come together and form one thing, which is multiple myeloma. I look at, and that's all the questions I have was multiple myeloma. But since you didn't get diagnosed, I just felt like, okay, let me start giving you in chips, and things like that. Then the issue of the breast, you just missed, the lady told you that she's worried about the breast cancer, about you didn't even ask any symptoms that has to do with the breast. If not for the fact that I was on a volunteer, please examine my breast, please ask me about my breast, please, because I'm scared. So that's alone, even if you fail to ask, would have, asked, give you probably the mind to ask her of breast discharge, sorry, nipple discharge, breast swelling, breast pain, go around the breast, because that is what has really troubled her.
Okay.
So I think that's then the issue of also the pain. When the person gives you a back pain, you have to probably characterize that pain with Socrates too. You didn't characterize the pain using the Socrates. You should have, decide the onset, the gradual, like in this patient, the pain tends to be worse at night.
Okay.
which is in keeping more in keeping with multiple myeloma. And then
Okay.
also the so what I've like these are some I don't know that these are the some of the um, correction that I just think I should offer, because the patient you have to think of also under differential diagnosis is metastatic breast cancer. If if peradventure is having, because since he has
Yeah.
family history, it could still
Yes.
be maybe it could still be even ovarian cancer, because BRCA1 gene which is common in the family can affect both the breast and ovary. So if it's not breast, it should be ovary, because the BRCA gene, which causes breast cancer, BRCA1, BRCA2, can cause both ovarian cancer and breast cancer. If a sister has breast cancer, probably also look out for ovarian cancer in her too. That can also metastasize. So these are some other things you should ask vis-a-vis. I think Dr. Bazin. Thank you.
Okay.
Mm,
Okay, thank you, Dr. Hinari. A good
yeah,
case and with a good manifestation and complex. You have to think widely, Dr. Samia, why you didn't reach the diagnosis, but at least you give differential, maybe
yeah.
closer to the differential of our case. But the fibromyalgia here, you cannot put it at all. Why? Because the muscle or tender muscle parts should be multiple parts, not only the back. Okay.
Yeah, actually, I couldn't hear
Yes.
specifically if it's one part or so I couldn't.
It's okay. It's okay.
Yes.
The other differential, by the way, here you can put is cancer, lung cancer. Patient is smoker for long term and she's heavy smoker, right?
Yes.
If you can add coughing up of blood, it would be the accurate differential in this scenario if she's coughing up blood, right? If this
Yes.
patient, for example, is having hemoptysis for long term, she will have the
Yes.
same manifestation, even
Yes. Yes.
the manifestation of the metastasis. The same as
Yes.
for the breast cancer with bone mets, right?
Mhm.
There's lung cancer with bone mets. But in this
Yes.
scenario, it comes in a different way, which is multiple myeloma, anemia due to the blood disease itself, not related to the bleeding, okay, or something related to the loss of blood. Here it
Yeah.
is anemia because of the blood disease or the blood disorder. Anyway, it's the difficult case, by the way. It's not easy. I was
Yes.
lost also in the middle. I
Yes.
didn't know the case, but I think Dr. Henry put it as a good differential to remind the whole about this topic. Multiple myeloma, it
Mhm.
comes in bases. So you will have the CRAP,
Yes.
C4, C4,
Hypercalcemia,
hypercalcemia,
Calcemia. Yes.
R4,
Renal
yeah, renal
renal
involvement.
involvement.
failure, and
Yes.
A4, anemia, the B for bone.
Uh-huh.
You already, I think you had all of them, but
Yes,
you didn't connect all together, or you couldn't link why this patient is having low urine output after it was high output or high
Yes.
urine output. So it's renal failure after he was or she was hypercalcemic with a high or increased urine output. But in the history taking, really, you follow the best approach I like. Apart from the past medical history, which you ask later on, but it's okay. The most important thing to ask the questions together. So the onset course duration as complaint, the relevant system here as constitutional symptoms. Whenever you have one of the constitutional symptoms in the complaint, you have to analyze it as relevant system. I mean,
Yeah.
fatigue, one of the constitutional symptoms, right? So you will ask
Yes.
about other constitutional symptoms, increasing like night sweats, night body temperature, lumps or bumps, and change of the weight or a change of appetite. In this case, you got one of them, which is
Yeah.
positive.
Just the loss of appetite also. Yeah. Because of that
Yeah,
also,
that's
I
why you
a
have to
little
ask
bit lost. Yes.
all
Like.
questions. Don't ask
Yeah.
one question. The dizziness you can add here as also constitutional symptoms. You ask about jaundice, also one of the constitutional, particularly with the liver disease. And the last is itchiness, again in the liver disease. The next system will be because you ask already for the relevant system, which is the constitutional. Now you can ask about past medical history or any condition I should be aware of, any
Yes.
surgery, any procedure, any allergy. You ask all this question, any medication you are on. Sometimes they bring patient with herbal remedies, and this herbal what might be the cause of the symptoms. So please, if you have diarrhea, for example, remember the herbal. If you have hypertension and you don't know the cause, you are thinking about herbal, remember the herbal as a question, particularly as a licorice. It was before old scenario. So the patient is taking licorice and he has hypertension due to this. Other herbal related, the liver disease might be related also to herbal. Patient is taking herbal and it harmed the liver. So these three conditions you should ask about the herbal. The diarrhea, some patient will take herbal to induce diarrhea and the patient will come with profuse diarrhea. The patient will be manifested as a dehydrated patient and the reason will be, for example, herbal induced. It's not our case today, but by the way, I just mentioned the herbal as a questions. The next system, the systemic review. I think you ask from the head down to the toe. All question you ask, I am not sure if you ask about the skin rash or
I asked, yeah,
okay.
ask about the rash
The
and skin.
muscle pain and the back pain here was good question to ask because sometimes if you ask about joint pain, he will not tell you about the back. So put or add to your musculoskeletal question any joint pain, any muscle pain, any skin rash, any back pain, particularly when you have a complaint in the musculoskeletal system. Add to them back pain. Some patient will not mention to you the back pain unless you ask about it. Okay. The family history here is very important. The breast cancer. Why? To put it as a differential.
Yes.
The smoking hair also, it was the last question or the last package of question you asked, but you couldn't again correlate. It might be lung cancer because of the smoking. That's why you didn't put it as a differential.
Yeah,
So,
because I asked about the cough and cough of blood, it's negative, so
but
I
there is
thought
short
it's
of breath. There is
yes,
short of
they
breath. Yeah.
related maybe to the anemia, so a
Yeah,
little
it's
bit.
related of anemia, of course, in this. But if you put differential in this scenario, you
Yes,
have to give cancer, either
yes,
cancer breast as a family history positive,
yes,
or
yes,
smoking related, so cancer
yes,
lung, or our
yes.
case as multiple myeloma. These are the differential for this scenario, I
Oh,
guess. And
yes,
I think the examination you did all, the back examination, I think you did, right?
yes.
Okay. What else you have to do in this scenario? The recreational drugs and sharing needles. What do you think the
Yeah.
importance of this? How to
Um,
give it as a differential? Sharing needles, tattooing, piercing,
mm,
any constitutional symptoms, you can put HIV as a differential. Even in this
oh,
scenario, you can say HIV if she has any risk factor or risk habit. If this
oh,
patient is sharing needles, okay, she might have HIV, and the HIV might present with all manifestation of infection, and the patient will be again positive in constitutional symptoms, positive
mhm,
in lymphadenopathy, loss of weight,
yes,
loss of appetite, right? So you
yes,
can
yes.
simply mention HIV if she
Oh,
has one of the risk factor or risk habit. Even one is positive, you can put HIV as a differential. The same as for lymphoma. You can put lymphoma as a differential in lymphadenopathy. You will never forget the HIV as lymphadenopathy differential, right?
yes,
And by the way, if you have lymphoma, they will put for you one risk factor. You can correlate the HIV as a differential in this scenario. So lymphoma, HIV, you can add also TB if he has contact with. This is my
mhm,
point. If you have
yeah.
any constitutional symptoms, you can put HIV as a serious infection as a differential. Okay.
Oh, okay, okay.
Yes, I think the multiple myeloma here discussed. Oh no, Dr. Hina, I think he didn't discuss, but the main investigation you have to do, including the general investigation. I will ask you that now in turn. The first thing, what general investigation you should do? Because you didn't answer
Uh,
as multiple myeloma. Yeah, tell me
yes,
now.
yes. We will check for the plasma cells. I think if there's any.
No, general. I'm talking about baseline workup or basic tests.
Uh,
Specific, you mentioned now the specific plasma cells.
y- yes, the blood picture, preferred blood picture. You mean?
Okay.
Mhm.
CBC, the most important
Yes,
basic
the full
test here
picture.
is the CBC. Looking
Yes,
for
white blood cells if it's the large number.
why white blood cells?
I think the plasma cells related to the white blood cells.
But he has anemia, so instead of looking
Yes.
for the blood cells or plasma cells, I don't think
Yes.
plasma cells are reflected by blood WCs or white blood
Right?
cells. Yes.
Okay.
So, by the way,
So
you
the
will do
anemia.
plasma cells for bone marrow, right? Bone marrow.
Yes.
So
Yep.
how you can reflect it in the white blood cells? It's not, I think.
Oh,
Okay, back to the CBCs for anemia. One of the
yes.
manifestation is anemia. What else?
Yes.
General
Um,
investigation. Do you think kidney function
the
important?
renal
Exactly.
function test here is very important. Yes.
This is the second component of the definition.
Yes. And
And
urea electrolytes here. It's also important. The calcium
exactly,
also.
calcium, and you have to mention calcium profile or bone profile. So
Yes.
you do the whole calcium, phosphate, vitamin D.
Yes.
Okay, you have to mention them.
Yes.
Why? Because in some patients you might have hyperparathyroidism. I should rule
Mm-hmm.
out.
Mm-hmm.
But in
Mm-hmm.
this scenario, supposed to be hypercalcemia without hyperparathyroidism.
Yes.
Okay? Because this is
Yep.
one of the manifestation of the disease. Okay. Then the specific you mentioned plasma cells, right?
Yes.
And you
Yep.
can mention here also blood film or peripheral blood smear.
Yes.
The image, what image you will do here?
We will do the starting from the chest, the spinal X-ray, and also we
Perfect.
can do a spinal. Even DEXA scan here is important because she is
Perfect.
already
Yes.
features. Yes, we can do it also, and the MRI of the back also.
Yes. These are the image you have to do.
Yep.
You mentioned already the chest X-ray, right? Okay. The invasive tests, and we already mentioned in the specific
Yes. Yeah, the bone marrow.
bone
We will
marrow.
check
Yes,
for the
looking
plasma
for
cells.
plasma cells. Yes.
Yes.
The
The
management plan.
protein, John's proteins or something like
Yeah,
that, I
yeah.
think.
This one also one of the perfect you remember. So one of
Yes.
the most important bedside tests, or you can say specific tests, urine for Benz Jones
Devastating.
protein.
Oh, okay, okay.
Okay,
Oh,
and
And
protein electrophoresis as well. It's important to mention.
yes, serum protein erythropoiesis, urine protein erythropoiesis, these are things you need to do. Also, looking at this patient, you need to do like what Dr. Bazim said, a whole body scan.
Mm.
If we can do this,
mhm.
also the score can give you a clue when you start seeing the punch out lesion or what they call
Mhm.
pepper pots. So you see something like a punched out or solitic lesion from the score. That will give you a clue too. And
Yeah.
then also you can do what they call this thing, erythrophoresis too, where it's the M spike, you know,
Mm.
and still you can also do peripheral blood smell, because some willow formation will be there, and then you see you can go ahead. There's can go ahead to further rule out other differentials to this patient. Like this kind
Yes.
patient, you also consider even as she's a female patient with fatigue, with signs of hypercalcemia, sarcoidosis too. You may want to consider that, as this patient with similar features, although no chest manifestation. You want to
Yeah.
consider, he is on analgesic for a bone pain that's not causing kidney impairment. Can be
Yes,
analgesic induced,
yes, yes,
kidney disease, chronic interstitial nephritis leading to what is having now. Also these are patients you have to also want to rule out metastasis too, like what you said in
yeah.
the which and
From the
then
breast or
your
from the
yeah for the
chest.
in that case you see you have to do your
Mm.
alkaline phosphatase, which will tell you in multiple myeloma, it is alkaline phosphatase is not raised because it's an osteolytic lesion. So the alkaline phosphatase is normal, unlike in malignancy, in which it is
Mhm.
elevated. These are some other things you also look at. Also, Paget's disease too, although that is not, all these are differential diagnoses you will want to consider in this patient.
Okay.
That's another addition to what Dr. Bazim said. Thank you.
Okay.
Okay, but always put the most relevant as a three differential. I think
Okay.
Paget disease cannot be because you have a lot of manifestation, and Paget disease he can present only with bone pain
Breast
without
back pain.
anemia and other manifestation, renal failure. Okay.
Yeah.
Anyway, let's go back to the investigation and the
Mhm.
management plan. how to manage this patient?
So the management here, the most important that we need to admit the patient because he has sign of dehydration and sign of anemia, anemic heart failure actually. So
Mhm.
this patient need admission, fluid replacement, and yes, because also there's sign of renal failure maybe also. So
So
yeah,
before that, what's the best term you have to mention? If you have renal component and you have anemia, you have short of
like
breath.
ABC, ABCD for
Okay,
this
this is for
patient.
the acute. And after that, after the ABC, MDT. Always
Yes.
remember
Okay.
MDT. Okay?
Okay. Okay.
Because you have to refer the patient to nephrologist. He might have
Yes.
dialysis, renal
Yes.
replacement therapy. Okay. As well as for the heart or for the echo to confirm
Yes.
the function of the heart. Okay.
Yes.
Blood transfusion, you have to check for his hemoglobin.
Yes.
The bone, the orthopedic, he might have a stylitic lesion, which might be
Mm.
affected the spinal cord. He might have intervention. Remember
Oh.
always this approach or this approach whenever you start managing any patient with multi-system affection, you have to
Oh.
specify or you have to mention
Yeah.
multidisciplinary team approach.
Yeah.
The pharmacological option, about multiple myeloma.
I'm not remembering actually. No.
Okay, just remember regime of chemotherapy or chemotherapy regime.
Oh, okay.
Right, one of them is dexamethasone, but there is also chemotherapy agents, so the
Oh,
steroid plus. Okay, and the definite treatment for multiple myeloma.
it will be stem cell transplant or something like that.
Perfect. Yes, yes, you're right. Perfect, Dr. Samia. I think we covered the topic and the approach and the performance for both of you today were perfect. Any question, Dr. Samia and Dr. Henry?
Yeah,
Thank you. Thank you so much.
thank you so
Thank you for
much.
the
Thank you
chance,
so much.
Dr. Basim. Thank you.
Okay, most
Thank
welcome. I will ask you the last question, Dr. Samia. I just remember. If you
Okay.
have lung cancer, what
Mhm.
specific type of lung cancer you can suspect in this scenario?
With the hypercalcemia,
Yes,
the squamous cell carcinoma.
perfect. Yes, perfect. This is the last question today. Anyone with question?
Dr. Basim,
Yes, Dr. Rahada.
if there is patient like this scenario, and I ask her if there is any mass in the breast, but she said no, I must
Yeah.
examine the
No,
patient.
no,
Sorry, I examine the breast or no need?
no need. No need at all. If you want to do, offer it. Ask the examiner permission and the patient permission. I would like to do so.
Okay, thank
Okay,
you.
anything related to the private area or something private to the patient, before going further, you have to ask permission from both the examiner and the patient. Any of them said no, don't proceed and just tell him or the examiner at the end, I would like to do examination also. For example, if you want to examine inguinal lymph node, you suspect any cancer in the pelvis or in the abdomen, and you suspect there is lymphadenopathy, and the patient told you, yes, I have lymph node in my groin area. So at that time of the examination, you will ask the patient, can I examine? And I will ask the examiner, can I proceed with inguinal lymph node examination? If both of them accept, proceed. If the examiner told you skip, you will skip. If the patient said, no, doctor, I cannot, skip it and tell the examiner, I would like to examine it. Clear? As well as for the
Clear,
breast.
thank you.
Okay, for the breast as well, because it's sometimes embarrassing. You have to offer it. You have to offer it. Don't skip it by yourself. So if, for example, the previous scenario for
Okay,
the gynecomastia or galactorrhea, I should do them. It's one of the diagnostic and pathognomonic tests in the scenario. Patient is having discharge in the nipple, but the patient might feel embarrassed to examine this breast. So I would like to do so. Or I will ask the patient first, then the examiner. If they agree, I will start examination. Otherwise, I would like to do examination of this area or for the breast or whatever the area. Clear?
clear, thank you, Doctor.
Okay, thank you, Dr. Rada. Any other questions? Anyone with doubt or question? Any missed point, suggestion?
No.
Okay, thank you, Dr. Henry. Dr. Samia, we will end the session if no more question. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
وعليكم السلام.